Criminals are finding ways to assume your medical identity, putting your health at risk by mixing their history with yours. Medical identity theft is a relatively new crime, and it hasn't even crossed most people's minds.
I hadn't heard of that.
It's something I never really thought about.
It's being reported more and more.
Sue Biederman, president of the Texas Health Information Management Association, says it can actually get you from two directions. Crooked healthcare professionals have been using patient information to file fraudulent claims for a while.
The majority of the cases right now are actually what they're calling insider crimes.
Now, another form of medical ID theft is becoming more common. Thieves are getting their hands on your name, social security number, or insurance information.
That's a little worrisome. Yes, it is.
Then, posing as you, they can have major surgery or get prescription drugs. That means you not only have bad information in your files, you can get stuck with big medical bills, be turned down for jobs, or worse. Biederman gives one example of how medical identity theft can hurt or even kill you.
The person who stole the identity might have listed that they had no allergies, and then the original patient come in for care and be prescribed a medication that they might be allergic to.
Oh yeah, I guess that could be pretty catastrophic, yeah.
The World Privacy Forum estimates 500,000 Americans are victims. Biederman says the real number could be much higher.
What's also very frightening about this is many times people don't even know that it's there, that the erroneous information is there.
The problem has found its way into local hospitals, including one of the area's largest.
It's happened occasionally here at University Hospital.
Administrators at University Hospitals say they do all they can to make sure patient information doesn't get out.
We want our patients to trust that we are protecting their information to the best of our ability.
Still, keeping thieves from getting in is tough. Right now, a photo ID system is in the works to help prevent the crime here. Using a similar system, workers at one hospital caught about a dozen people a week trying to steal patients' medical identities.
We're trying to implement this as soon as possible.
The sooner the better, because once your medical ID is stolen, it's hard to fix the problem. The World Privacy Forum says victims of medical identity theft have far fewer rights than victims of financial identity theft. Biederman says that's because of strict HIPAA laws designed to protect patient information.
Now we've tightened things down so much, ethically, we have to answer the question, is it right to go ahead and give the patient the information or the access to the chart, even knowing that some of the information in there is not theirs?
But it's a problem you can catch if you know what to look for. Biederman suggests keeping a copy of your medical records so you can compare it to your doctor's files from time to time. And watch out for these things.
Some of the red flags are getting billed for something that didn't happen, or seeing something reported on an insurance report that didn't happen, or noticing something in a medical chart when seeing a provider.
I'll keep an eye out for that.
Now, Biederman says we need extensive research and national guidelines put in place. She believes that's especially important as records move from paper to computers, which could make it easier for hackers to get your information.